Good morning, Dr. Alley. How are you?
Good morning. I'm good. How are you, Dr. McGuire?
Good. Thank you for joining our session. So today we're going to talk about orthodontics. This is your field, your expertise. The word orthodontics to just the average young adult, possibly looking to get into this field, who may know a little bit about it but doesn't really know much about it. So, how would you best define orthodontics?
So, orthodontics is a specialty field of general dentistry that specifically focuses on moving teeth and also promoting favorable jaw growth and development. So, there are multiple dental specialties, and orthodontics is just one of them.
Okay. So I want to make note that you represent Clark Orthodontics and you are the owner,
That's
right?
correct.
Okay. And how's that going?
It's good. So I feel very lucky to be in the field that I'm in. My father started the practice in the late 80s. And I joined the practice in 2020 when I finished my own training. Um, and we worked together and still somewhat work together. But it's a wonderful profession to be in just because of the amount that you get to interact with people and help people. And that's what really drew me to it in the first place. And we're located in South Jersey. We have three office locations. And, I feel really lucky to
Yeah.
get to do what I do.
Right. And now knowing you for quite some time now, it's great that you are part of the community and you help others and the families, and it's a great thing. Um,
Right.
so let's talk about your education leading up to getting into this field. What did that look like?
So, anyone who's interested in an orth or a dental specialty, you have to become a dentist, a general dentist first. So after 4 years of college, I went to dental school, and typically dental school is additional 4 years of training. Um, and in preparing for any application for dental school, it's important to have some experience in the field of dentistry first, because applications are always going to ask if you've had any shadowing experience or volunteer experience in dentistry. And not only do I think that helps with an application in getting into dental school, it's also helpful to the person who's interested to get exposure to the field of dentistry, before pursuing it, because then you can figure out if it's something that you actually are interested in and would like as a career for yourself. Um, I was introduced to orthodontics at a pretty young age because my father is an orthodontist. So I grew up working in the office, and I always thought that it was an amazing profession, and I really admired my dad and liked what he did. But personally, I never thought that I would do it myself. Mainly because I had this mentality that I wanted to blaze my own path, and I didn't want to do something just because it was expected of me. And growing up, the oldest of five children, I felt like I had a lot of pressure on me to do what my dad did. And even though there was nothing wrong with that, I kind of wanted to
Mm-hmm.
do my own thing. So when I went to college, I did get involved in the pre-dental society there. And I don't know if every college or university has a pre-dental society. I'd venture to say that most do. Um, Probably most have a pre-med society. So if you are interested in pre-dental and they don't have a pre-dental society, you could probably get involved in the pre-med, and it's going to help you get a lot of like the prerequisites that you need. Um, but getting to explore dentistry outside of the context of my father, that's what really helped me decide that it was something that matched my interests and was something that I did really want to do and I had a passion for. So while I was in college, I got connected with local dentists and I shadowed them in their offices. And then I also uh, I had the opportunity to do an internship with UCSD in San Diego, their pre-dental society, which is really robust. I did an internship with them for a whole summer where I was volunteering as a dental assistant in their free clinics there that provides services to an underserved population. And for me, that was really the experience that solidified the fact that this was really something that I wanted to do, at least dentistry. I still wasn't sure that I wanted to do orthodontics specifically. Um, so having the shadowing or volunteer experience in dentistry, and then also the courses that you take in college are helpful for your dental application because they're going to have a lot of requirements, like in the maths and sciences. I personally majored in biochem, which helped me meet a lot of my requirements for applying to dental school. And it's also something that I was personally interested in. But you certainly can major in a non-scientific field and still meet your requirements, or if you don't meet them in college and then you decide after the fact that you're interested in dental school, there's always post-bac programs that will help you reach the requirements that you need course-wise. Um, and obviously, with any higher education application, you're typically going to need good letters of recommendation and writing a personal essay. But beyond that, you also have to take what's called the DAT, the dental admissions test, which is very similar to the MCAT,
Mhm.
but it has a specific portion of it that tests the applicant's like perceptual ability. And those are things like problem solving and being able to like visualize things in a 3D space, which is pretty cool, which is what, you use a lot in dentistry. Um, so, I fortunately got accepted into dental school the first time I applied, but it is a pretty competitive process. I went to University of Maryland in Baltimore for 4 years, and it's actually the first dental school in the world, which is really cool.
Wow.
There's a lot of history there, and they have a cool dental museum as well.
Hmm.
Um, so 4 years of dental school. Typically, most dental programs, there is one program in California that's 3 years, but most are pretty much all are 4 years,
Hmm.
where the first 2 years are more focused on didactics, um, coursework, and then the second 2 years are more focused on clinical training, and actually treating patients. Um, so uh, you get experience hands-on while you're in dental school, which is amazing. And it's all under the supervision of an attending doctor. Um, so for me, uh, sorry to interrupt.
No, good.
It wasn't until I got in the clinic and, started actually like, seeing patients, treating patients, and um, getting to see how orthodontics might help those cases. So there were a lot of times where I kept thinking like, oh, I wish I could move this tooth or,
Hmm.
do this, and it would make the case a lot better and a better outcome for the patient. So that's when I started to realize that I did have my own interest in orthodontics as well. And then applied during like between my third and fourth year. That's typically when the applications go out. Um, for any dental specialty, it's like a match program or system where you apply to the residency programs, um, and there's like a rank list, and then you get matched to a specific program.
That's a lot of stuff.
It's a lot of stuff. So I actually didn't end up doing orthodontics right away after dental school. The most direct path to specialty would be to matching into a program immediately after dental school. And those programs range between 2 to 3 years. It's a little interesting. There's not like every program is different as far
Yeah.
as the length of time, and also like whether there's a tuition or you get a stipend or you get a master's degree in addition. So there's a lot of variability. Um, I ended up doing what's called a GPR, that's a general practice residency. So for a year, I worked for Virtua Hospital in Camden, doing more general dentistry and getting additional training in more like advanced cases. And for me, that was an invaluable experience because I still really loved general dentistry. It wasn't like I only wanted to do orthodontics and didn't care about anything else. And I also felt that being a really good general practitioner and having a solid foundation in all of like those skills and philosophies would help make me a better specialist.
Mhm.
Um, so that was just 1 year. And then I got accepted into an internship with Temple University in their orthodontic program. And then I became a resident there. So it was a long
Can you repeat that
process.
for me? I'm kidding.
Yeah. So basically, four years of college, 4 years of dental school, and then I did an additional training in general dentistry, and then I did 3 years of orthodontic training.
Wow.
So a long time.
So
Uh,
let's assume though, if the traditional path, somebody after high school wants to pursue this career and everything you just said, age
right.
wise, if we circle a pencil around, what age would one be in decent shape to pursue?
So, well, you could be practicing as a general dentist as young as 26.
Wow. Okay.
Um, because I graduated in 2016. Yep. So, because it's 4 years after college. And depending, like there are some programs where you can, like some schools offer what's called like a dual degree program,
Mhm.
where they have like an agreement with a dental school. So, for example, I know that Rutgers has this dual degree program where you get accepted into the undergraduate program and into this 7 year dual degree program in addition. And as long as you maintain uh, a certain GPA and as long as you score a certain score on the DAT, you'll automatically be accepted into the dental program at Rutgers, unless that's changed since
Yeah.
I applied. Um, and Uh, sorry.
It's all right.
Um, and I'm actually going to turn the volume of this down.
Yeah.
Um, so you could um, basically start dental school after 3 years of college in that case.
Okay.
Um, and then you would be finishing like a year early. So, if you knew already that you really wanted to do dentistry,
Yeah.
as a graduating senior in high school, I think those programs are great. For me personally, I was not sure that that's what I wanted to do. So, um, even though I was accepted into the 7 year program, I wasn't ready to make that decision as far as what my, career was going to be. And I really wanted to experience everything in college and kind of figure it out on my own first before making that decision. So I feel like the path that I chose helped me personally
Hmm.
find my way to dentistry, but there's lots of ways to get there. And there are plenty of people that also choose dentistry as like a second career. I had fellow classmates in my dental school that were starting out in their 40s and
Oh,
they had, a career in finance or architecture or what have you. And, had a good experience with that, but then kind of got bored or realized it wasn't for them and learned more about dentistry and thought that it was an amazing career. So it's something that, you can choose at any time. And so after college, you do the 4 years of dental school, you take your boards, and there's a national boards and a state boards exam and each one has a written portion and a clinical portion or hands-on portion. And after you pass your boards and get your dental license, then you are free to practice general dentistry. which
I'd
is
be exhausted at that point.
how did I feel at that point?
No, I would say I would be exhausted at that point,
Oh, yeah.
right?
Well, it is a lot to go through, even just to get to that point. But I think dentistry is a great field comparatively to medicine because after 4 years of medical school, you're not like usually you typically have to continue on with more training in a residency in order to be a licensed medical professional. It's nice in dentistry that you can start practicing as soon as you finish dental school, as long as you pass your boards and
Yeah.
uh, are able to get your license
Well,
and
let me ask you,
graduate.
with all this training and schooling and dedication, I'm sure it's hard for some people to keep their eye on the prize, right? Because you're putting so much time and effort into it, and everybody's different. I get that, but what would you recommend? Like, what are some of the strategies to keep one going to know that there's light at the end of the tunnel?
Yeah, I think that's a really good point and question. I mean, I think it was helpful in my experience during the training that the point when you get to be in the clinic and start treating patients, and then you start getting the reward back of, having helped someone and having made a difference in someone's life.
Yeah,
At least for me, that's what kept me going. Definitely the first 2 years of dental school is a little harder when you're not in the clinic yet and you're taking all these courses and um, it's a little bit, it's more easy to get discouraged. But I think just reminding yourself like what your end goal is, and that it's worth it to get there. For me personally, my residency experience was more like trying and difficult and stressful time in my life. Um, and yeah, it was definitely, there were moments where it's easy to say, even at that, because at that point, I was already a general dentist. So it's always something you could fall back on and say, okay, well, I don't need to finish, I don't need to
mm-hmm.
be
Mm-hmm.
an orthodontist. I can still practice general dentistry. But, for me, I knew that it was something I was passionate about. And I felt like what drives me is being able to help other people. And I felt like I could help the most people in the most meaningful way through orthodontic treatment. So that's kind of what kept me going is knowing that like I'm going to be able to help the most people this way.
All right, well,
Um,
let's transition into everything you just said into your practice. Clark Orthodontics,
Mhm.
um, located in South Jersey, several locations, and we'll put that information up for those folks. Great organization. So you have all this experience, and here you are. Fast forward to your role now. Let's talk about your interpersonal and communication skills, and not necessarily you, but what does one need in that category to be uh, an effective person, an effective leader. Tell me some of the traits about you.
Well, I think one thing that's certainly helpful in any field of dentistry and specifically orthodontics is being able to work well with your hands. Um, you know, and if it's not a skill that you have at the beginning, it's certainly something that you'll hone through all your training. Um, and not only being able to work well with them, but liking to work with your hands and being hands-on and doing something. So I think that that's a helpful part. Um, and then in addition to that, I think even if your technical skills aren't, you know, to perfection, I think what's more important is how you personally treat your patients, um, and your communication skills.
Give me an
So,
example.
so, you know, I feel very strongly that we treat all of our patients like their family, and not just our patients, also our staff and our team members. So I think that that's important to, treat people with compassion, um, with care, because, at the end of the day, it's not just, you know, did their tooth get filled or did their teeth get straight? It's also about the experience that they had during the time that they spent with you.
Mm-hmm.
Um, and, I think it helps one be successful in the dental field to have good rapport with your patients, and the bedside manner is really important. So it is a really, or it can be a really social profession where, even though we have our hands in people's mouths a lot, we are, at least for me, I do like spending a lot of time getting to know my patients, and, you know, I, um, I make sure to ask my questions when we're not actively in their,
Yeah.
um, but yeah, I think, forming relationships with patients, um, is really important, and it's rewarding for me too. That's part of why I chose the profession, is because you do have that opportunity to, you know, build relationships with people, and make a meaningful difference in other people's
Can
lives.
they be learned? Can these skills be learned? Because if you have an introvert who wants to go into your profession, right,
Right,
and they're not as friendly or have all these skills, can that be learned?
right. I certainly think it can be learned, or it can be, I saw something about this the other day where, if you're an introvert, you might not become an extrovert through dentistry, but you can learn the skills enough to at least be able to portray an extrovert when you're with your patients, and get that kind of, um, good rapport, but you don't necessarily have to suddenly identify as an extrovert. And there are also certainly other specific fields in dentistry where, if you don't like talking to patients a lot, or people a lot, where you can still be really successful in that regard. So, there's certain types of procedures where, I mean, in orthodontics, we're seeing patients like on a monthly basis for almost 2 years, sometimes longer if we started seeing someone when they were really young and they weren't quite ready for treatment, and then we're just following them until they're ready. And then we often will follow patients after they get their braces off, when they're in their retainer. So we're seeing patients, over a long period of time. So I think in orthodontics specifically, it is really easy to build these strong relationships with patients. You certainly don't have to, but I think it
Yeah.
helps. Um, Whereas some other specialties, for example, endodontics, which is root canals, I mean, I know a lot of very outgoing endodontists, but you don't have to be that way, an extrovert in that profession, because a lot of times you might only be seeing a patient one or two times to, you know, address their specific concern and infection, and then you're never seeing them again. Um,
Mm-hmm.
so, there's lots of variability, and I think different specialties kind of match with different personalities a little bit better. But I think in general, even if you know, don't, you're not looking for building like a big relationship with patients, I think communication is still such an important part of being a good practitioner, to make sure that you're like articulating the, what the problems are, what the treatment goals are, and what, about the final outcomes. And I think patients when we have good communication with patients, then that is going to create a good experience, in that regard, because then everyone is on the same page and there's no questions about
Hey,
anything.
that's life, right? That applies just
Yeah.
about to everything.
Oh,
And you have a lot
100%.
of personalities, a lot of clients. How many clients would you say you have to deal with, roughly, or over the span of the practice?
Well, um, I mean,
I'm not whatever.
on a given day, I'm interacting with 40 to 60 patients
Wow.
a day. And that's actually, I would say, on the small, we're a small practice. There are some orthodontic offices that see over 100 patients a day.
Oh,
Um,
not only do you have the student, let's say if you have, just an example, the student and child personality, right? You have the parent personality,
oh, mm-hmm.
a lot of moving parts there. So let's talk about your practice for a couple of minutes.
Okay.
So Clark Orthodontics, let's talk about everything about you. This is your time to let us know what's going on over there.
Well, I appreciate that. I also was really excited at the opportunity to just talk about, orthodontics as a profession because, I'm passionate about it, what I do, and I think it's an amazing career for anybody. So really grateful for the fact that I got to talk about this to help maybe
Mm-hmm.
inspire someone to, explore a field of dentistry or orthodontics specifically. Um, but we are a small private practice, family legacy. As I said before, my father started the practice when he finished his training in the late 80s. Um, and he's mainly been a solo practitioner the majority of his career. Um, and I was lucky enough to, eventually follow in his footsteps and join the practice in 2020. And we worked side by side for a handful of years. And then I took over ownership of the practice in January of 2024. So I'm just past my 1 year anniversary of being a business owner. So
Congratulations.
thank you. And I'll just do a little tangent. Another great reason why I think dentistry is a wonderful career because you also have the opportunity to become a business owner
Mm-hmm.
and have like a lot of say over your day to day and control over, your workplace.
Mm-hmm.
But it doesn't, not every dentist or orthodontist is a business owner. So you also have the option, if that's not something you're interested in, you can become an associate or a partner or an independent contractor. So
Mm-hmm.
for me personally, I do really enjoy the business ownership aspect of it and getting to, create a workplace that I'm proud of. And so I'm very lucky to be like a legacy here and that I had the opportunity to work with my father and kind of take over a practice that was already, well established in the area, but also has a lot of room for growth. Um, our staff, we're a small staff, which I think is nice because I think it lends itself to a more like close-knit family feel. The majority of our staff has been with the practice for over 30 years, which I think
Wow.
is really wonderful. And I think speaks to the fact, I hope that, we're a great place to
Mm-hmm.
work for. Um, and, I've had the chance to hire one new person since I took over the practice. And I hope that they'll want to work with me for the, duration of my career. So I aspire to maintain that, a workplace that people are happy to be at and be a part of.
Mm-hmm.
We have three office locations, Haddonfield, Voorhees, and Woodbury Heights. And of the model of our practice is that I'm the only doctor and we have our staff that's the same and we travel from office to office. So that can sound strange to some people, but that allows us to one, reach a little bit of a larger patient population. And then also that way patients are always seeing the same familiar faces,
Mm-hmm.
and it helps with continuity of care and they're not seeing like a different doctor every time. So
Yeah.
helps to keep the care like streamlined and efficient. Um, so when we're working in one office, the other offices are closed. But any patient can be seen at any office location.
Hmm.
Um, and we treat children and adults. I always say there's no such thing as too old for braces.
Really?
Yeah, I think we have our oldest patient is in their 80s,
Wow.
and we have maybe treated someone in their 90s, but it's all case dependent. Um, and we typically recommend that the first age to be seen at the orthodontist should be around age 7 or 8. That can sound really young to a lot of people. Um, at least for us, we're almost never doing treatment at that age, but it's a good time for us to see patients just to screen them and make sure that there isn't anything developing that would require an early intervention. And it's helpful for us to, start to build a relationship and rapport with the patient and the parent, have them be comfortable in the office, and also be able to prepare them for what to expect in, the coming months or years. Um, it's a common misconception that, you can't get braces until you've lost all your baby teeth. We usually want to see patients before that point.
Let
Um,
me ask you. So, in addition to braces, because what other is? Tell me all the services that you provide, just so you know, family units can understand where you're coming from. Is it just braces? Is it other things? Like, what does that entail?
so braces is really just one tool that we have to move teeth. So we use braces and aligners. So they're just different ways to move teeth. So clear aligners are the plastic trays that fit over the teeth. We use Invisalign in our office, but there are many aligner, products out there on the market that people are probably familiar with. Um, and we also have different types of braces as well. So Invisalign or clear aligners, that's a removable appliance where you take it in and out. Braces is considered a fixed appliance where it's fixed to the teeth or cemented to the teeth. So we have traditional metal braces, and then we also have ceramic braces, and those are just a more aesthetic option that are blended more with the teeth.
Hmm.
Um, and then those are our typical treatment modalities, but we also have additional like appliances that may need to be used depending on the patient's case. So for example, someone who has a narrow palate and a posterior crossbite, we would use an expander. Um, and there are some other,
So there are options, right? There are
yes,
options.
lots of options.
Yeah.
Sometimes we have patients who come in who had braces when they were younger and they just have some minor relapse in the bottom, and they're wondering if there's something that they can do for that without having to go all the way back into treatment. And depending on the case, there are some times where we can make a special type of retainer that does help the alignment without needing to go all the way back into treatment. Not every patient is a candidate for that, but there's lots of different things that we can do, whether a removable appliance or a fixed appliance to help with patients.
Right.
Um,
Yeah. All right. Well, so not to interrupt you, but a couple more questions, but I don't want to hold you too long. So all this is good stuff. What kind of leader, since now you're running your own practice, just so we can understand you a little more? What kind of leader are you?
um,
I'm putting you on the spot now. So
yeah. I mean, I hope I'm a leader that leads by example. I think growing up, being the oldest of 5 kids, that helped me naturally like be in a leader type position. And I think, I kind of live by the what I consider the golden rule, treat others how you want to be treated. And I think it's important that um, if you treat others that way and, lead by example, I think that helps foster an atmosphere around you where, people want to do the same and are happy to listen to you and follow your instructions. And um, I think also I'm a leader that welcomes questions and criticism. Maybe like I tell my staff if I'm asking you to do something you don't understand why I'm asking you to do it, ask me and I'll explain it to you. And because I think it's helpful for when people know why they're doing something. Same with patients too. We tell our patients if you have a question, if you don't understand why we're asking you to wear these rubber bands, you're not you're going to be less likely to do it. But if you know why you're doing it, then I think it helps give people the motivation to do what needs to be done. So I think um, coming back to a good communication and just treating people well, that I feel like that's like the kind of leader that I am.
I like it. So would you say, your empathy, your active listening skills, all those things, right? And they may sound basic on the upfront, but when you incorporate, and I think you do, all those things, it makes the flow of your operation, more functional.
Right, 100%.
Right. Well, I thank you for your time, Dr. Allie
You're
Clark,
welcome.
Orthodontics in South Jersey. Definitely love what you do, and I think this will resonate with hopefully a lot of people in the area. Any final thoughts, or I wouldn't say encouragement or advice, but something that you would want to give a closing message to those who may be interested in the field?
I think, sometimes people look at my story and say, "Oh, it was so easy."
Mm,
You followed these these steps and then you got where you wanted to be. Um, but I think, it was still hard to get to where I am as far as like one figuring out that that's what I actually wanted to do, even though in hindsight it looks like, oh, it makes sense how I got here.
yeah, right.
But, even though I did, follow those steps, and it got me to where I wanted to be, I think it's also important for people to understand that it is okay if you don't know what you want to do for the rest of your life right away. And it can take some time to figure that out. Um, and, like I said before, I think dentistry and orthodontics is an amazing career, but it's also something that you can find later in life. And it doesn't have to be right away.
Mm-hmm.
And not only, being the doctor in the practice is one way to be a part of dentistry, but there's also ways to be involved in the dental field without having to necessarily become the doctor. So, I think dental assisting is an amazing career as well, being part of the administrative staff. I think there's lots of careers within a dental practice that are an amazing choice for anybody, depending on your skills and your interest levels.
Mm-hmm. Would you say that industry is economy proof?
Um, I don't know. I'd say it's 100% economy proof. I don't know that anything is, but I think people are always going to need a dentist.
Yeah.
Um, I think when the economy does get tight, we are affected, because especially orthodontics in some ways, because, when money gets tight, orthodontics to some extent is an elective procedure, or treatment. So sometimes, even though it would, significantly improve patients' functionality and stability and health overall, a lot of people don't look at it that way. And so it's easy to say, okay, well, we're gonna, you know, put this off until later when money starts to get tight. But, I do think there's always going to be a demand for dental treatment, whether it's orthodontics or general dentistry.
Mm-hmm.
Um, and I think the more we also educate the population that, investing in oral health also improves general health, I think that's an important thing to note as well.
Right. Lastly, the one thing I wanted to ask you in the beginning, and we may have touched on it, but what's the difference between dentistry and orthodontics?
So general dentistry is like the big field, I guess. Um, when you're a general dentist, you've completed 4 years of dental school at minimum, and you may have had some additional training after that. Um, and a general dentist, typically, they're going to mostly be dealing with fillings, crowns, bridges. They'll have their hygienists in the office for the cleanings, and the dentist will be doing the exams and treatment planning in that regard. Um, when you get into more specialized treatments, for example, a root canal, extraction of impacted wisdom teeth, um, gum grafting, um, treating really young children. Those
Mm-hmm.
are all examples of specialty things, but a general dentist, in theory, can do any of those things, but a specialist has more advanced training in that particular field and has more experience treating more difficult cases, um, and does that day in and day out. So for example, if you need heart surgery, even though your you know general doctor might have learned about it and know about it, or general surgeon might know about it or how to do it, but you might want to specifically see a cardiac surgeon for
Mm-hmm.
that
Right.
procedure.
Makes sense.
Um, so, um, same thing in dentistry. So, a general dentist is able or to do some orthodontic treatment limited, and they can do a root canal, they can take out teeth, they can see kids of any age, and they can place an implant or do a gum graft if they've had that training. But if you need any of these specialized treatments, it's often a better idea to see the specialist, because that's where you're going to get that customized, specialized care by someone who has the additional training and, does it day in and day out.
Yeah, that makes sense. No doubt. I just wanted to clarify that because
Yeah, I gave you a little bit of a longer answer than you're looking
yeah,
for,
yeah,
probably.
sure
But
some
orthodontics is one of the specialties, and we specifically specialize in moving teeth and promoting favorable jaw growth and development.
yeah, great. All right, Dr. Ali, I will let you go. I do appreciate it. Clark Orthodontics in Southern New Jersey. Pleasure. You're doing a lot of great things. Keep it up.
Thank you so much. I
All
appreciate
right.
the
Thank
opportunity.
you.